Yeah, so it's interesting. And I'll answer the topic of clinician burnout from the perspective of what I'm hearing from delivery systems as we do this work and trying to understand kind of healthcare delivery systems and decisions that they're making. I think in this effort to sort of move towards value-based care, there's a lot of things that are required of clinicians anymore. We have the EHR and all the documentation that's required, prompts, decision support, entering of information, less and less time often to spend with patients, and increasingly regulatory burdens and paperwork requirements and so forth and so on. So that creates this burden. Some would describe it as less joy of practicing medicine. And if you have less satisfaction or fulfillment in the work that you do, what's going to happen? You're going to potentially look for another opportunity. I think that's true probably in any occupation. And certainly I think that's been true in the healthcare professions as well. What I think some organizations, delivery systems in particular, are trying to do is to think about how they can involve team-based care, how they can involve individuals being a part of that team who have a certain skill set that can relieve the practicing clinician, the physician, the nurse practitioner, the physician assistant, from some of that burden to really get them back to practicing medicine with their patients. And really, that's why they got into the profession. So a lot of these new models will involve technicians or nurses or other members of the team who might, for example, be in the exam room and enter the information in the electronic health record, who might assist in sort of the documentation of the notes. Ultimately, the clinician needs to sign off on those. So it's really thinking about how they can allow people to practice at their highest level. And for physicians, for nurse practitioners and PAs, it's seeing patients and spending the time that they need with patients, and not circumventing the need to kind of document, but just thinking about ways in which you can bring a team to that to sort of make, again, get back to making the practice of medicine more joyful and less burdensome.